Thank you, Dr. Baba. Uh, so like I said, we're very excited about this digital curriculum. Clicker. Gee, I thought you just clicked for me. And our ability to actually bring it to people outside of North America. So we have divided the curriculum, again, as why offer a digital curriculum? In North America, one of the issues we have is everybody's interested in the digital type of technologies, but the problem is that no one really sat down and looked at what the educational portion of that would be or what it would look like. So you had a lot of a hodgepodge and a lot of people going in different directions. So with 63 dental schools, between 63 and 65, depending on what moment it is, in the United States of dental schools, that was not available. Nobody really had a lot of experience with that. So what we wanted to do is take people that did have experience with it and be able to put it into some type of a curriculum format that the dental schools could easily use and be able to use with it. So we have a lack of faculty with experience. This is one of the issues we had. Most don't have that. And so part of this curriculum is to kind of generate that type of activity. We have limited resources for developing curriculum for, again, not everybody had the resources to actually do that. So part of this thing is how do you build a curriculum, and then how do you build in a plan that allows dental schools to look at it, to be able to go to their administration, go to their deans, and explain why this may be a direction to go in, how you would economically put it into your school, and what it would do for you as you come out. Again, we had a problem with insufficiently trained faculty in the dental school. So this is one of the biggest problems most dental schools have. For example, in my dental school, when I try to implement it, you go to the chair, you ask for champions, and you get crickets. Then you go to the dean, and he sends out, and then you get crickets. So a lot of people are afraid to get into it, or they just see it as something else. And so you have to find a way in which to do that. And part of what we're offering here has some hints on how to get faculty involved. And again, it'll be really helpful when you hear from Dr. Kasabi and Dr. Wu on how they got their faculty involved with it. And then students see dental technology as part of their future practice. If you have a dental school, the first thing every student asks that's coming there is, are you guys doing digital dentistry? I mean, we see it at our school all the time. We have over 4,000 applicants at the University of Louisville, and almost every one of them asks, do you guys do digital dentistry? And if you say no, then you're off their list. So they're going to go somewhere else because they know it's part and know it's coming. So in history, again, in 2015, we launched the initiative through the Educational Foundation. And in relatively short order, between that time, 2015 and 2017, a very comprehensive curriculum was put together. Now, that is a very short period of time for anybody that's been in education in the past on building a curriculum and how long it takes to do something. For what you're going to get out of this curriculum, it's hard to believe that it was actually put together that quickly. We have then we piloted it with 5 different schools. Now, each one of those schools was at a different level, and that's one of the reasons why we brought 2 schools. They're on either end of the spectrum. So in Rutgers' case, they really hadn't had a digital, and we're getting into it. And on UCLA's, he's a little more advanced. He's got all the toys, and they get him putzing around with it, but they really needed some direction on how to put their curriculums together. So that's why we brought those 2 schools here to kind of explain what they did and how it affected them. Because a lot of times, if you have a digital in your university already, you're trying to think, well, what will the curriculum do for me? But you'll see that this curriculum is inclusive from the didactic classes all the way through the clinical classes. So right now, as Brian mentioned, we're about 85% of the schools. Pretty soon, I'm pretty sure we'll have 100, but for the next month, in fact, we might have it now, as far as I know, that have asked for the curriculum or have implemented it in some way or form. We do send out surveys off and on to find out where they are with it, and so I think we're getting ready to send out another one just to kind of see where people are with the curriculum. Some people can implement it relatively quickly. School systems, if you know how universities work, the curriculum kind of moves slowly through the system. So the question you have to ask is, what's in the curriculum? Well, when you get the curriculum, it's going to look like this. And we have learning objectives and competencies. So, you know, when we write syllabuses and we're writing our things, we need to have learning objectives and competencies. Now, how great is it if somebody gives those to you, so you don't have to sit around and think about them and come up with them? Because I know when I sat around and did it, it took me a while to figure out these, but We're actually going to give those to you for each of the sections that we're looking through. And again, it's broken down as it goes through the curriculum in areas. So the framework is we're going to give you a framework for things. So we'll talk to you about dental anatomy and how it would be enclosed in dental anatomy, how you bring in that course. The design of this whole thing is basically taking a first-year student and getting them familiar with all the technology all the way to the point where they get to the clinic. So with scanning technology and things and ability, the other thing that's nice about it is the way that it offers things. So it's an implementation strategy. So it tells you different ways and gives you options on ways that you might bring it in. So it's not one of these things where you get the curriculum and the expectation is that you're going to follow it from the front to the end. It's kind of a guide, per se. And it's going to give you examples. So for example, it'll give you laboratory exercises that you could use and how you would incorporate them and what you would do at each of those parts, depending on whether you're doing fixed or whether you're doing operative or you're doing dentures or you're doing dental anatomy. So it'll give you a framework for what that laboratory exercise might look like so that you have an idea about how much time it is and what kind of things are happening with it. It's built not just for dental students, but also post-grad. So there's a whole section on it just for postgraduate schools. So if you have a prosthodontic program, it's going to give you strategies on how you would implement it in your prosthodontic program. Again, it's a full range of courses. It has for implant strategies for implant dentistry. We have some for diagnosis. Fixed and removable prosthodontics is also in there, so you're going to find those areas. We're going to find direct patient care. There's going to be things in there that are going to kind of apply to those workflows. Dental anatomy, which is a really nice one that's in there, is again, most dental students are taking dental anatomy their first year. This is a great time to teach them how to scan and being able to use different softwares that allow you to look at what you're supposed to be building and then what you actually are and then getting an independent feedback. So the digital dentistry and the systems that are involved in that explain how to do that and how to incorporate that into your program. And we also have operative dentistry. So again, same type of thing. The whole idea being is to integrate these systems in as they're going through their entire didactic phases to learn how to use the systems. So it basically starts with scanning very early, design moves into it, and by the time that they get into the clinical portion, they already understand how to use the scanning, how to use the diagnostic tools, how to use the design tools. And the new thing that they're doing in the clinic is they have a patient now instead of a cast or instead of something else that they've done. So the whole thing is to integrate that in to the point where they get into the clinic. As well, in treatment planning, there are also some hints on what type of treatment planning would be in there, what kind of codes you would use. Those types of things as well are there, so that you don't have to look all those up either. And as we update those things, we'll update those codes and things that become available. So again, the nice thing about it is that the content is easily put into your syllabus that you have already. So if you have a dental anatomy syllabus, and I like to use dental anatomy because that's the one that kind of catches everybody off guard. Everybody thinks of the patient scanning, but we're talking about in a dental school setting, one of the biggest problems you have is students don't like doing their wax up and then coming in seeing one instructor who gives them one opinion and then another instructor gives them another opinion and another, or the fact that they like to wax at night. And this generation likes immediate feedback. So these technologies allow immediate feedback. So we get competency statements in there. There are learning objectives. It gives you evaluation strategies and sample of the laboratory schedule. So all those things are written into that curriculum. And again, like I was saying, it uses didactic courses. And oh, by the way, I don't teach dental anatomy, so I'm not pushing that. It's just that's one of the things that I found to be really creative on how we approach this at starting at that first year level. And actually getting people to learn how to use the scanners, use the ability to register things back and forth. And some of the techniques that you have to learn to scan to do this, or a lot of things that are going to carry over as you go through the rest of the curriculums in your digital types of training. And again, just reemphasizing, the goal here in our curriculum is to get it in the first year. So they don't think it's just how they do dentistry with patients, that it's actually a tool for them. Okay. So the big confusion here, and we had this discussion in my school, was a lot of my students are saying, well, then why are we doing all this other stuff? Why don't we just have a digital thing because everything's going digital? And your answer has to be the same as I have a lot of other things, is it's just another tool, okay? Dentistry isn't digital dentistry. Digital dentistry is a tool to get to the restoration at the other end and another way of doing it. So it's trying to get them to understand that it's just another tool for them as they walk through the whole process. And again, the beauty of all this technology and the way that a lot of the companies are presenting as software, and as software develops and as technique develops, it provides guidance and feedback 24/7. So we all have DMD students, and they expect somebody to be there. They think they pay a lot of tuition, so they expect to, me to be there 24 hours a day for what they're paying, and I try to explain to them that it costs them a lot more if they want that. But this gives them that feedback because they like to work at weird hours. They like to do different things. It allows you to leverage the needs of a lot of students. For example, some schools have 30 students, some have 60. My school has 120. So how do I deal with 120 students with a minimal amount of faculty? Leveraging this technology can sometimes provide that feedback if you can make it accessible and find unique ways of making it accessible. And it provides an objective tool. So for some reason, students don't mind if the computer tells them they did it bad, but they don't like it when I tell them they did it bad, even though I might describe the same place. But they don't have a problem with the computer scanning and telling them that they didn't do the mesial box correctly. But they'll ask me, and I'll tell them one thing, but then they don't like my answer, so then they would go to Dr. Wu and see if he gives them a better answer. Not that any of us have ever seen that happen before. But this kind of tells them, and gives them some guidance. This is what you need to change. And then there are resources with it. So we have some self-assessment and self-directed learning things that are in that curriculum. There is some financial analysis for pre-doctoral clinical education and patient care. So there's some statistics in there that allow you to kind of look at how you would implement this. And so if you had to go to your dean to get money to develop it, there is some strategies in there for them to show what the cost effectiveness of going maybe more digital in the way that you apply things as opposed to just the way that you've been doing it in the past. We do have, and you will have the abstract is part of it that you'll get access to, and you'll get, there is a glossary of digital terms that was developed by the ACP, and we're updating that this year, as a matter of fact. Both of these are being updated this year. And again, the nice thing about the abstract is it's linked to certain journals, so when you click on it, it'll go right to that journal article immediately. So you don't just get the abstract, you can get the entire article. So those are things that will come with the curriculum that's available to. Again, it comes with a 7-step communication plan, how to study. So in that, it's going to give you a way in which to approach it. And then we have some supplemental sources, which are not ready for prime time for you guys yet, but we're finding a strategy to do that. In the North American, when we went to a bunch of different educators and asked for material for North America, they graciously gave us there's slides, there's handouts, there's all kinds of really nice stuff. We're trying to figure out how to make that available to you. But right now we don't have that solved, but we do have the curriculum that you can get to. There is an ebook that is available to you. It's on iPad, it's on Apple and on Kindle, both now, right? Yeah, both. So we have both available to it. It's at the whopping price of $9.99 for educators, so it's not a very expensive book, but it's a very good book and it's very thorough. So, so this is now available and at a very reasonable price. So it complements the curriculum. So as you're going through the curriculum, you could use this as your text for doing it, and we try to make it as inexpensive for students as we possibly could so they would be interested in using it and being able to use it. So how do you get started? So if you go to the website, and you guys have all got the little brochures there, I think has this information on it. Just go there and then go to the curriculum access page, and then you just submit a request for access. What will happen is it'll automatically kick you back, if I remember correctly, a website, and you click on that and you'll get the curriculum. So you can download it right there off the curriculum. So for you guys, it's very easy to get to it. There'll be a part to fill out, and part of the reason we want to know who's getting it is as we develop things and we change things, we want to make sure that we let you know. Also, as we begin to expand our services, like providing access to the supplementals that we have, we want to know who we're going to provide those to. So this is kind of a way for us to kind of check on that and see how that works out. And also to get you that information that says when we've figured out a way to do that, that we can send a link to you and say this is how you get access to all the supplementals. The supplementals are very, very nice. I've had some beautiful, some really nice presentations that were given. There are handouts for different schools on doing different systems. There's a lot of stuff so that you don't have to spend all your time reinventing the wheel. because a lot of people have already made the wheel, and so just many are getting it and then maybe applying it to how it works best for you. Again, it couldn't have been possible without Henry Schein and their group to actually put this together. Again, once you get the curriculum, you're going to see it's, I mean, I didn't see it in whole until at the end of the done, and I was just absolutely amazed about what was in there. From having to deal with curriculums at my school, it was like, wow, this is great, because all I got to do is plug it. I just have to plug it in. I mean, it identifies the skills that they need. It identifies all the objectives, the learning objectives, and all the things that you need for validation. For, of course, in North America, we have CODA. I'm sure there's something similar to that in Europe, and it fulfills all those needs about what's required out of an educational course.